Washington, D.C., well, it's one of many areas with large black populations also struggling to respond to a surge in COVID-19 cases.
And we all know by now the dangers of the virus. Anyone can get it, but it is disproportionately killing African Americans with underlying health issues. Howard University in Washington, D.C. is one of many HBCUs reaching out to the surrounding community to help. They recently received a $1 million grant to improve access to COVID-19 testing. Joining us tonight is Howard University President and Cancer Surgeon Dr. Wayne A.I. Frederick. Welcome to BNC Prime, Dr. Frederick.
Thanks for having me.
Oh, quite welcome. And Dr. Frederick, let's start off with the grant itself. Free testing begins when? Today, is that correct?
It actually started today, 10 a.m. to 2 p.m. Today, we saw a couple dozen patients, and so it started off as anticipated, but we're going to have significant demand.
So who can be tested and where can they go?
Right, so the facility is located in Southeast DC. We're targeting primarily the residents of Ward 7 and 8. We have three primary criteria: patients with symptoms, patients who may have been exposed because of someone that they know was positive, or patients who may be concerned about an exposure but without all the hard data. You don't need a physician's prescription to come in. You can call in, describe to us what's going on. We'll take a few questions, and then we'll make an appointment for you to come in.
Of course, Howard, located in Washington, D.C., where there is no governor, so there's no state to close. I'm wondering how D.C. has responded and how Howard University itself has responded to the pandemic.
Sure. So the DC mayor has issued a stay-at-home order, which will expire on May 15th. But unfortunately, we are seeing a surge in cases at present. Howard University has its own hospital as well. And currently, our ICU is to capacity. We have a significant number of patients from Southeast DC. As a matter of fact, just over 50% of all the patients at Howard University Hospital right now are from Southeast DC. So the response from the mayor has been a stay-at-home with social distancing, only coming out for essential activities such as going to the grocery store, etc. And that has continued, I think, to help flatten our surge, as it were. But the downside of flattening the surge is that you can lengthen the time period over which the pandemic may last in the area. At Howard, we shut down and went to distance learning early in March, and we have also decided to do distance learning for our summer school as well. And so we'll be doing that throughout the summer. We're beginning to look at plans for the fall. Just stood up a committee, and that's going to be a complicated task, to say the least.
Dr. Frederick, I have to tell you, you're speaking to a fellow Trini, by the way. We know that you are originally from Trinidad and Tobago. So I do have to ask you about people in the Caribbean. We know African Americans, of course, having a difficult time. What about Black people in the Caribbean?
You know, I actually have been in touch with the folks in the Caribbean, in Trinidad and Tobago and Jamaica, primarily seen news out of Barbados. And I think actually they're coping well. Trinidad and Tobago in particular, the Prime Minister there, Dr. Keith Rowley, he and his government seem to have done a very good job of controlling the situation and making sure that people stay inside, et cetera. There are not a lot of ventilators, not a lot of ICU access. So really avoiding people getting the infection, I think, has been key to the Caribbean countries' success. And so far, they all seem to be having some modicum of success with managing through the situation.
And Doctor, you in your capacity at Howard, I'm sure that you're talking about other HBCU, talking with other HBCU school leaders about the upcoming year. You've given us a sketch of your plans, but what are the plans that you may have in concert with other schools to kind of help each other out?
Yeah, you know, we, the HBCU presidents, we often speak a lot on a variety of issues, and it's complicated as to what we're going to do. I am currently the chair of the consortium of university presidents here in the Washington regional area. So that includes American U, Georgetown, GW. And we are also trying to collaborate and look at it. I'll give you one example. There's a lot of talk about testing, but what if we have a student who tests positive and needs to self-isolate or self-quarantine? Doing that in our current residence hall setups may not be practical. So we are looking at potentially a collaborative and shared resource solution in which we potentially stand up one building that we all can access, that our students can access in the event that we do that. So this is going to be complicated. We have to do it with our municipalities, and I think all of the HBCUs are certainly looking at it from that perspective as well. We also serve a population of students that are significantly under-resourced, and so the ability to go back and forth from home to school is going to be limited. And so the other thing that we're looking at is just to make sure that we make a very firm decision if we do come back to face-to-face instruction, that we have all the things in place that can keep the students in our municipalities once they do get there.
Well, what about students who are maybe study abroad or international students? Are they affected, and how?
Yeah, very much so. We had several students who were in study abroad programs. As a matter of fact, one of the weekends, we barely were able to stop a student from making it all the way to South Korea, which at the time was becoming a hotspot. So we had to bring all of those students home. And then subsequent to that, we also had to get our international students home as well. There still remained about 24 international students who stayed in the DC area. And we arranged to put them up in apartments in the DC suburbs for the duration of the semester, which will end at this coming Friday. So definitely there's a lot going on as we think about bringing students back for the fall. Bringing international students back is going to be tricky. We have to look at what the circumstances are going to be with respect to international travel. And I think just as you're seeing around the country, as New York, which was the epicenter, begins to wane, you are seeing progression of the disease in different areas, such as in DC. And we have to be cautious and thoughtful about where else may that be happening. And it may be happening in international sites yet to declare themselves, especially as the seasons change. So we will be looking at all of that in terms of how to bring students back appropriately. And then study abroad in the fall will certainly be affected in terms of being able to get students to those sites. And so we're looking at alternatives for students who may have planned for study abroad in the fall.
And one final question for you, Doctor, as far as research is concerned. We know that Meharry, for example, is at the cutting edge of doing research on COVID-19. Can you give us an idea of what Howard is involved in along those lines?
Yeah, certainly. Dr. Hildreth at Meharry is a longtime researcher in the field of virology, and I think has stood up a very interesting setup at Meharry. And so I'm glad and proud that they're leading there. At Howard, we're looking on the testing side. We're looking at the different tests that could be useful, rapid testing, as well as antibody testing, especially when we start bringing our students back. We do have a couple of researchers that are looking at treatments, and currently we are participating in a trial looking at using different drugs in the treatment for patients that have COVID-19.
All right, wonderful. Thank you so much, Dr. Frederick. If you're in the Washington, D.C. area, we also want to give you the number to call for Howard's testing site. That phone number is 202-865-2119. Dr. Wayne Frederick, we thank you so much for joining us.
Thanks for having me. Appreciate it.
Thank you.